Welcome to the Modern Nurse Podcast. My name is Emily Knife, and today we have a very special, wonderful nurse guest, human advocate, angel, and survivor. And her name is Rachell Dumas. Thank you so much for being here and joining us on the show today.
Thank you so much, Emily, for having me. Um, I'm I'm excited to talk to you, to share with you, to be vulnerable with you today.
Yeah, thank you. Yeah. We're both a little just kind of off. We were talking a little bit before we got on to record this podcast with you. And so, just kind of coming out with a little bit of a trigger warning. We are going to talk about some really very, very very important topics that aren't talked about and spoken enough of. And I'm so excited to have Rachell on here to talk about and advocate and be a light for those that may be in a time of darkness. So, Rachell, go ahead and tell us a little bit or a lot about your nonprofit and your mission to help those that are in a time of need.
Yeah, absolutely. So it's hard to talk about my nonprofit without telling my story first.
Yeah.
So let's get started with that first.
Okay.
We'll jump right in. In 2018, I had my first pregnancy. It was not planned, but I was very excited, ready to be a mom. And I had bleeding at the same time. And I didn't know too much about or have experience with pregnancy, but I knew you shouldn't be bleeding during the pregnancy for the most part. Went to the OB, got an ultrasound, and he told me that I was miscarrying and that this was all a part of the pregnancy journey. Unfortunately, this happens, and that I will go on to have a healthy baby and to not be too concerned about this, which was so ironic considering my pregnancy journey from 2018 lasted until 2022, almost the last day of that year. So I went on with my life, got engaged, got married, um, planned my wedding. And in 2022, I was doing a travel assignment in New York. And I got sick because of the lack of supplies and came home to try to regroup and found out I was pregnant. This time with twins. I was terrified just because of the twins. I wanted a baby. I don't know if I ever wanted twins, but nevertheless, I was excited. But again, I was bleeding and had been for a while, and I didn't know how long I was pregnant. So I went to the emergency room. They diagnosed me with a threatened abortion, which is saying that I could possibly miscarry because of my bleeding. But at the same time, they also reassured me that the babies are fine and to just follow up with the OBGYN, which I did a few days later. Followed up, and my symptoms got really bad. I had excruciating pain. The bleeding got heavier.
Mm-hmm.
I was terrified that I was losing the babies again. And I thought about what the OB said in 2018, immediately thinking, man, this is not what's going on. I'm not having this healthy pregnancy like he said I would. At 13 weeks, I lost that first baby and all my symptoms stopped and I felt great. So I was still hopeful. I was like, well, I'll still be a mom. This baby's doing well. I just was reassured at my appointment that the baby was healthy, the bleeding stopped, pain stopped. We're great. The morning of my gender reveal, because I finally got comfortable enough to allow my friends to celebrate me, I woke up and I was like, something's wrong. I don't know what it is. This is not a good day. And I called my friends and I told them that. All of my friends came over. They were decorating. I just went to the bathroom and the baby fell out.
Oh, man.
I remember just being on the floor, crying and wailing, and the music was so loud, no one even heard me. And I did that for about 30 minutes before I was able to gather myself up and tell them what happened. It was at that moment that I knew something was wrong with my body. This is a real problem. I don't care what the OB said in 2018, this is not supposed to be happening. I went to the ER. I told the ER doctor what happened and told her the baby fell in the toilet. She asked me, how do you know you were pregnant? I went to this hospital probably 15 times during this pregnancy, and they had the charts. And to be asked that as I'm going through such a traumatic loss is just even more devastating. It's an insult to injury. I got my treatment. I followed with the OB and was diagnosed with cervical insufficiency, which is
Mhm.
when your cervix is pretty much too weak to carry a baby. So once the baby is heavy enough and it's sitting on your cervix, the cervix will open and the baby will fall out. The
Okay.
cure to that is called a cervical cerclage, a transvaginal cerclage, which is a suture around the cervix to keep it together. So no matter how heavy the baby gets, the cervix stays closed and you can carry the pregnancy. So I was reassured that, okay, if I got pregnant again, we'll get this done at 13 weeks, like she said, and I'll be able to be a mom then. So I was hopeful.
Yeah.
I had a series of early losses, which became another issue. Why am I losing babies at 6 weeks and 7 weeks, 8 weeks? So I
Right.
saw a reproductive geneticist to make sure there was no genetic component to these losses, which there wasn't. I also saw a reproductive, a reproductive endocrinologist who did a lot of testing and examined my uterus to make sure there was no abnormalities in shape or, anatomy that could be causing this, and it wasn't. So she put me on hormones, one specifically called progesterone, just to try and carry me to the second pregnancy. The next year, 2021, I was able to meet with the reproductive endocrinologist. I found out I was pregnant. She put me on the progesterone. I took the suppositories, made it to the second trimester, made it to 13 weeks, made it to the OR to get the cervical cerclage. Very hopeful.
Mhm.
Procedure went well. The doctor said come back at 20 weeks. We were at 13 weeks. 7 weeks is a long time to not see a doctor with my history of loss. I
Yeah.
literally begged her to see me sooner.
Wow.
She said no, she refused. So trusting her, me being a trauma nurse at the time and not knowing
Mhm.
anything about maternal health, I said, okay, well, she must know. She said, you would definitely feel if the cerclage fails. It will be painful. You will be bleeding. It's literally a suture ripping through
Yeah.
your cervix.
Yeah.
Makes sense to me. I'm like, okay, well, I don't know if something is wrong. Went home, 7 weeks passed, and I'm feeling awesome. I went to a maternal fetal specialist doctor and was ready for my 3D ultrasound. I never made it this far before. We're at 20 weeks. The ultrasound tech just left the room and said the doctor would be back. And I knew immediately something was wrong. I regretted immediately not advocating for early appointments. I regretted it. And sure enough, she came back and said, your cerclage failed. And you can go to the maternity triage and deliver your baby very nonchalantly. And I asked, when the baby died, you know, like I'm just supposed to go and deliver? She said, yes, at this point, the baby would die. And I'm like, or can we not do anything else? Can we put in another cerclage, go back to the OR? Can I be on bed rest? And
Mhm.
the amount, I have pride, but the amount of desperation I had that day, I would have kissed her feet if
Yeah.
she would have told me we could still try.
Yeah.
And she said no. So I went home and said, I'm going to fight for this pregnancy. We're at 20 weeks. It's so long as I've been pregnant. I refuse to go and just deliver a baby and watch
Yeah.
him die.
Yeah.
So I called everybody I knew. Like I said, I was a nurse at the time. I called every manager, every coworker, every friend, every family member, a stranger. If I thought they
Yeah.
could help me.
Yeah.
And we found a doctor in Dallas, Dr. Falwell, who is literally my saving grace. And I told him my story. He said, please fly to Dallas. I chose him because he previously, one, he was the one of two that even responded, but two, he also saved a 20-week pregnancy of twins. And I was like, well, I'll just have one baby. Maybe this would be easier for him. Flew there, he rolled out the red carpet, went to the OR. He told my husband at the time that it'll take about 3 hours. And it took 8 hours for him to put transabdominal cerclage, which is higher than the vaginal,
Yeah.
to hold the baby in. He said it took so long because the baby kept trying to come out and they had to gently push him back.
Oh my gosh.
So I woke up on the anesthesia, literally fighting anesthesia. I remember saying, am I pregnant? Am I pregnant? And there were a bunch of healthcare providers surrounding me, just cheering me on. We're still pregnant. It was always me.
Oh.
I mean, the best hospital service I've ever gotten at Baptist Health in Dallas, Texas. I have to shout them out because they're just so phenomenal.
Mhm.
And once the anesthesia wore off, I went into labor. And I labored for 30 hours despite of all the medicine that they gave me. And at the end of the 30 hours, my water broke. And I had to go back to the OR, get both of the cerclages removed. And I had to deliver the baby at almost 20 weeks. and watch him pass in my hands.
Mhm.
So that was probably the lowest
Mhm.
point I would argue in my life. I just lost my grandmother earlier, who was my mom, basically. And it was just so much loss at this point. And I felt like my body was failing. And then I had so much guilt that I was essentially like, still getting pregnant, knowing the babies wouldn't stay or wouldn't survive. But I still had this urge to be a mom that I just couldn't fight. That was undeniable. But before I went back to that surgery, Dr. Falwell said, if this doesn't work, I'm bringing you back out here. And outside of pregnancy, we're going to put in this abdominal cerclage and we're going to get you your baby. And true to his word, that November, I went back to Dallas and he did it free of charge. I didn't pay anything. And I had a couple of miscarriages early, but then May 2022, I got pregnant, went to the reproductive endocrinologist, got on the progesterone, graduated to the maternal fetal specialist, made it past the second trimester, made it to the third trimester. And on 12/30/2022, I gave birth to a beautiful baby, Nazaire, who was fat and literally running around his house. At 4 pounds, 15 ounces when he was
Oh,
born, and so little in the NICU, he is now a thriving little boy, a little toddler.
oh, oh my gosh. Oh my gosh. Just hold space here for you for a second, Rochelle. And thank you so much for sharing your story and being vulnerable with us and everybody that will see this. It's to be human, right?
Yeah.
To be human. So thank you again for sharing that. It's so touching and there's so many feels when you were telling your testimony that I was feeling, not only as a woman, but as a mother, as a nurse, as an advocate. And I'm getting choked up because, it's something to get choked up about. And so thank you for sharing that. I really appreciate you.
Thank you.
Um, and so that little one running around your house is really kind of what forced you into this nonprofit.
Yeah,
Right?
yeah, it
I
did.
think he was the light that was like, let's go, mom. Let's share your testimony. Let's help others.
He did. He's the reason for my title, A Light After Nine, after all the losses that I just shared. He was definitely that light. Because when you're going through the losses, you don't know if you're gonna make it to the other side, whatever that is for you. For
Right.
me, it was finally having that baby. And I hate saying becoming a mom because I really count myself as a mom during those times. There's no way I'm
Absolutely.
a mom after flying to Dallas, Texas at 20
Yeah.
weeks pregnant to try to save a baby. It's no way I'm not a mom.
Yeah.
So I would argue that I was long before Nazaire was born.
Yeah.
But he definitely was the catalyst and definitely the light. And also this trauma that I experienced and these maternal health issues. I mean, at every level of a pregnancy, I experienced it
Wow.
really propelled me to start this business. I rested all last year somewhat. I mean, there is also a story of all the health issues that came along with all this.
Right.
But I knew this was needed. And once I was well enough, I really knew that I wanted to start this nonprofit because I don't want any other women, birthers, families, because it takes a village. It does. I
Yeah.
can't just cater to, just women or birthers or moms.
Yeah.
It's the partner that was next by my side throughout all this. It's the doctors where we have to educate them. It's the need for innovation that we need to address these disparities. So we do all of those things. We offer grants, we offer maternal mental health resources because that's so major in this. Even if you have a healthy pregnancy, you
Yeah.
need that resource. We offer a service where we're finding doctors and specialists and vetting them and making sure
Wow.
they're exactly what you need.
Wow.
We're advocating. We're teaching you how to advocate for yourself in that appointment because you can't advocate without the education.
Yeah.
Even I couldn't only imagine as a nurse, I can save your life. I can give you education. I can do a lot of things, but in that specialty, I know nothing more than the average person
Right.
knew.
Right.
So without that education, I couldn't have advocated for a transabdominal cerclage long before I got it.
Yeah.
I shouldn't have been rushing to get that at 20 weeks pregnant after the vaginal failed.
Yeah.
I don't want other people to go through that. There shouldn't be unnecessary loss, unnecessary preterm birth, unnecessary maternal death.
Yeah. Yeah, yeah. You made so many good points, and I love your mission. And I know when we were speaking briefly before, getting on this podcast session, we were talking about some of the statistics from the March of Dimes. And I'd love for you to just share that because when you said some of those numbers, I mean, I was thrown back. And as we both live in Atlanta, you would think, that we would have the best of the best. But it's not happening. It's happening in Atlanta, it's happening in LA, and
Yes.
it's happening all throughout the world, and the country. So it doesn't matter where you live anymore. It's happening to many women.
Yeah.
And so would you mind just sharing some of those statistics? Because that was mind blowing, what you
Yeah.
told
So
me.
for preterm birth, March of Dimes in a recent report gave the United States a D overall. In Georgia, where I'm at, it's a F. So it's a lot of work to do. I mean, like I said, we should never be afraid for our lives or at risk for losing our lives while bringing a life into the world. That should never be. We should at least be able to enjoy some part of this process because it's supposed to be a natural process. And
Yeah.
I don't feel like we can call it a natural process anymore at this point because of all of the health implications, all of the risks. I was watching this one podcast called Birthing Instincts, and he was just saying that he looked at this report. They were saying just being pregnant in general is just a high risk state of being.
Wow.
Whereas, we count high risk as a person like me who's had multiple losses or diabetes or hypertension. But no, he's right. Being pregnant is just high risk. Uh,
Yeah.
you know, so it's so many issues that go into those statistics, like healthcare deserts and complications that go unrecognized during pregnancy, uh, predispositions such as, like I said, hypertension or diabetes. The healthcare deserts, the maternal healthcare deserts are a big issue. There's no way I should have to travel 2 hours or travel over state lines to get the care that I need.
Right.
It's literally killing us and our babies.
Yeah. Yeah. Wow. So many profound topics and, so many, you know, nurses that are fighting with you. Um, it's so cool the amount of nurses with missions on LinkedIn, and in this online space. It's been really empowering to see so many nurses coming through trauma, burnout, and coming out on
Mm-hmm.
the other side and just like busting it wide open and just helping so many more people than if they stayed in a box mentality.
Yes,
And so it's so cool to see how, although it's painful at the time, how our trauma can propel us into these life-changing situations.
yes,
Where now you have this nonprofit. And so let's speak about healthcare access. And so I know you, in your nonprofit, do you do anything with the healthcare access, helping women obtain that, advocacy for that? Can tell us a little bit what that looks like.
absolutely. So there are a lot of maternal health deserts that's causing, like I said, the high preterm birth rate and maternal death and other maternal health disparities that needs to be fixed. Granted, I'm not in a position to build a hospital by any
Right, right.
means. I wish I was.
Yeah,
But that's one of the big issues. So, in order to help with that and advocate for that for our members specifically, we're making sure we're doing the research on different doctors that they need and suggesting doctors that they need because some people only feel like you should go or only know about the OBGYN.
yeah,
There are a lot of, especially in 2024, which is the beauty of it, in the technology age where
Yeah.
a doctor can, have licenses in multiple states, but also can see you via telehealth. So we can
Yes.
anticipate, or they can anticipate certain issues that may happen based on their health history, their OB history, just a
Yeah.
lot of factors. So we can get them to those hospitals that may be a little further sooner. As far as advocacy, I'm definitely partnering with other companies who have more reach as of now than we do, since we're in our infancy still,
Sure.
just to help with those by raising money, raising funds. That's really big, and you can definitely donate to us. Those funds also go directly to our members as well to make sure they're able to get the help that they need, because this is expensive as well. So it's a lot that we have going on. Definitely advocating for not only just more maternal health facilities that's comprehensive and holistic, but also making sure there are specialists there with the expertise that the patients need in that area.
Yeah. Wow. Yeah, that's a big job. That's a huge undertaking, and I appreciate that because, it takes getting out of your comfort zone and
Very.
contacting these specialties, and even just hearing your testimony and telling your story and all of the different specialties that you had to then go into. I didn't know how, I mean, we're nurses, and I think a lot of people are like, nurses know everything. It's like, I didn't even know any of those, to be quite honest. Like, I know OBGYN.
Right.
Like,
Me either. Me
yeah,
either. But we're still moms, and we have
right.
to learn them as
Yeah.
on this journey. But part of my business is that I don't want anybody to have to learn them
Yes.
once we're pregnant, once we've conceived.
Yeah.
Or, I don't want you to have to research these things in a moment of desperation like I did.
Yeah.
I'm going through the trauma. It's no way I should be having that thing on my computer to do research.
Yes.
I hate that for you. I
Yeah.
hate that for me. So if you come to us, we're doing that while you can go through and process that trauma and that grief and focus on you and baby.
Yeah. Wow, that's so beautiful. Yeah, I think, there's so much beautiful advocacy work. And, as nurses, I think that's really the ultimate, like, who we are. We're so advocacy for so many different things.
Yeah,
And, you know, um, you're potential, I mean, you're literally saving lives at this point because you're giving people resources early. So the prevention is huge, and that's where we kind of start getting away from sick care and into more of a healthcare realm of this preventional strategies that is so needed in maternal health.
yeah,
Because really that's where the disparities really start rising in regards to your own advocation
right.
within regards to your story. How many times you advocated and you got gaslit by the medical professionals that you are entrusted to help you live your best self and your best life. And here we are dealing with losses after loss, right? So, you know, what can we do as nurses to better help those in what was your situations, to comfort, to be more compassionate and empathetic? What kind of communication would be more helpful in that kind of setting? Do you have any suggestions?
Yes, I do.
Go
The
ahead.
biggest one that is about to seem just like a very obvious answer is active listening.
Yeah.
Active listening and believing what that patient is saying.
Yeah.
You know, there are times where I'm telling you, I'm in excruciating pain. I'm literally bleeding, but we're not doing further evaluation because of what you think is happening. Well, the baby is fine. We did an ultrasound. There could be further testing that could be done. Or after my first loss, why not do other testing just to make sure we're ruling out different causes? We could have tested my
Mm.
thyroid. We could have did genetic testing at that time,
Yeah.
further deep diving. There has been maternal death due to medical gaslighting and just not actively listening or believing what the patient is saying. And we really, as healthcare professionals, really have to remove any bias.
Yeah.
We have to listen to our patients, believe them, and really evaluate them. as nurses, I think we do a really good job at that in my experience. Not always, not always,
Sure.
not always, but a lot of what we do is just advocate. We're talking to the doctor because we're with the patients more than anybody else. And we're listening to them saying, oh, I'm going back to the doctor. I'm telling them to order this, this, and this. So continue to do that if you are, but then you can also advocate. There are a lot of different healthcare companies that you can donate to for them to advocate on your behalf, or talking to our state officials, certain type of voting,
Right.
health was definitely on the ballot, so there's different things you can do, but definitely educate yourself and then listen to your patients.
Yeah. Yeah. Listen to your patients. Yeah.
Your patients.
Yeah, yeah. And listen to yourself. Like it's interesting. I was speaking with Jennifer Johnson yesterday and we were talking about intuition and gut feelings,
Right.
right? And I think as a society, I'm just gonna say it, we've really discredited women's intuition.
Yeah.
Like women have amazing intuitions, like psychic ability
Yes, we do.
intuitions, you know? And so, it's really interesting. So I think like let's talk a little bit about those intuitive feelings and those gut feelings a little bit and how do you help moms that come to you when they have those kind of feelings, or do you even focus on that, or do you guys talk about that,
Yeah,
like that
we
intuitive
definitely do.
sense?
Yeah, we
Yeah.
definitely do. Like I said, when I had that twin loss, I woke up that morning and my gender revealed like something was wrong.
Yeah.
I would have never thought that day would have ended like that. You know,
Wow.
I just knew something was wrong. I could not tell you what it was. And, you know, I wish I would have went to the hospital. I hate having
Yeah.
that should have, could have. But with that pregnancy, I do wish I would have went to the hospital. I don't know what I would have told the ER doctor. Something,
Right.
can you please just test me?
Yeah.
That doesn't sound far fetched, but for some reason, I didn't have that confidence to do that. So when they come to me and they're saying, I have this intuition, I always ask, what are your symptoms? You
Yeah.
know, have you felt this before? Have you experienced this before? Go and get evaluated for your peace of mind, for your
Yeah.
peace of mind. Because if something happens, you don't want to, like me, go back and review the
Wow.
story like I should have done that. And then I also want to speak on us as nurses and
Yeah.
healthcare. What I do like, and we're in Georgia, so Emory is really big. I was working there as a travel nurse, and I have to shout out Emory for this because while I was there, they started to implement when we were communicating with doctors intuition. Basically, if we had an
Wow.
intuition or something was off, we should still document it and communicate that and talk to the doctor about it.
Wow.
So their rationale was that our intuition, if something was wrong and something was off, sometimes we just know, especially in
Mhm.
trauma, you could kind of feel
Yeah.
the vitals are fine right now, the medications are going,
Hmm.
he look all right, but something is just off.
Hmm. Yeah. It's an
Something
overall
is
sense.
off.
Yeah.
Yes. And
Yep.
they implemented that, and I was so proud of them because it makes
Wow.
there were so many times my intuition saved the patient's life.
Yeah.
Um, I just knew something was off. Can't
Yeah.
explain it to you, but something's off. We need to watch them a little more.
Yeah.
So kudos to that. But I also want to encourage other healthcare professionals that if you feel that, address that feeling.
Yeah.
You could be saving someone's life or
Yeah.
two lives in maternal health. So or three.
Yeah. Oh my gosh. Yes. Yeah. Yeah. Intuition's so cool. And I think people are just kind of still afraid to speak about it. But
Yeah.
it's like, dude, it's there. Like, what? Like,
Yes.
it's like talking about the food we eat. Like, it's an everyday thing. And like, we have intuitions happen every day. In fact, um, my friend was with me at a soccer game and literally like the ball came at his head twice and the first time he like dodged it didn't he saw like he just intuitively felt it like coming at him and then the second time he like lifted up his hand like intuitively and I was like that right there is intuition. Like we swerve sometimes around cars.
Yes.
We get distracted and we don't leave our house on time because there's an accident actually happening and we were going to be in it if we would have left, right? There's like so many cool things. So, what are some cool intuitive experiences that you've had like in your lifetime that you can think of?
Well, at some point, I really knew I was going to have my baby, and I knew it was going to be a boy.
Yeah.
I knew I was going to be a boy mom, and I'm trying to think of other. I don't. Unfortunately, it's just been a lot of trauma. My intuitive
Yes.
experiences have been negative,
Yeah.
unfortunately.
Yeah.
But as a mom, though, there has been some fun, intuitive
Yeah.
experiences with a toddler who climbs everything and does whatever he wants. And I've caught him without even looking. So
Yes.
it's a lot of that, I would say.
Yeah.
But that's why it's so important, right? It's a
Yeah.
gift that we were given that we shouldn't ignore.
Yeah.
We should not. So
Yeah. Yeah, absolutely. Yeah, I think that's so profound. So yeah, nurses out there, healthcare professionals, like just listen. It's gonna get louder. I just did a post about this. It's gonna keep getting louder and louder until like it causes you to have an accident, you trip and fall, and then it's like the universe, source, God is like, hey, listen, take
yeah.
a take a
And
moment
also,
and
though, if
listen.
you're a hospital administrator or in a healthcare entity, make an environment comfortable for your nurses and healthcare staff
Yes.
to vocalize that this is my intuition. This is what I feel like is going to happen. So a lot of nurses, a lot of healthcare providers have that feeling, and we just kind of like, no, we can't say it. So it's also about what the healthcare entity you're working at makes comfortable, makes a priority.
Yeah, absolutely. Yeah, I think that's huge. So, yes, healthcare facilities make it a priority because nurses are with patients 24/7. I mean, kind of, right? Like, I mean, we're with patients a long time and we get connected energetically to that patient.
Yeah.
And so we feel, and when we feel things are off, take a listen, please. So, yeah, that's cool. Yeah, I know Emory's big about really instilling a lot of those like holism and holistic kind of like research based, facilitated entities in hospitals, which is amazing. So, yeah, that's really cool. All right. So let's go ahead and we'll start wrapping it up. But I want to talk about how can people get a hold of you? So, how can people that need your resources get a hold of you? And then also, I know you're open to like partnering with various facilities, organizations, and partnerships. So can you just tell us a little bit about how people just can get a hold of you so we can start really funding your mission? Yeah, go ahead.
So I wanted to make our company our organization very accessible to families because, like I said, during this time, I don't need you guys to research. I need you to focus on you. So you can DM us, you can email us, you can call. You could fill out our form on our website about the different things and services that you're interested in. Please do that. Make it easy for yourself. You can DM me. I need help. We'll investigate that later. So please reach out. Instagram, TikTok, Threads, Facebook. I'm on LinkedIn. My name is Rachell Dumas. I'm very receptive. We email back very fast. So please feel free to reach out if you're in need or want to talk or whatever the case may be. I need resources. As far as partnerships, we are so happy to partner with not just maternal care or maternal health companies and organizations, but all. Our goal and our mission is to become an employer resource because so many of these issues happen at home. We're not in the hospital 24/7. We're at home thinking what to do next. What do I need? How do I get what I need? So as an employer, if you are employing a woman who wants to get pregnant in their childbirthing years or a partner who is going through the pregnancy journey or wants to go through the pregnancy journey, you need this resource. They need that assistance. It is vital. And if you're a hospital administrator, we definitely want to start at the bedside. We want to combine maternal health and palliative care. We need that hand holding for our patients who are going through this issue. And a lot of the night wants to be there. So please reach out. Let's put it in your healthcare facility and let's decrease maternal health disparities.
Yeah. Wow. Such a beautiful mission. And I'll put all of your information in the description so people can access you and just continue to support you and lift you up. And yeah, I'm looking forward to 2025 for you. I see big things happening, Rachell. So thank you again for being on the Modern Nurse podcast and I look forward to collaborating with you however we can serve you in the modern nurse world. And thank you for sharing your testimony and being so beautifully vulnerable and sharing your human experience. Thank you for touching my heart. I really appreciate that.
Thank you for creating this space.
Yeah, yeah, of course. Yeah, yes. Well, thank you again. And don't forget, we can always just take a deep breath and begin again. So, wherever you are, I hope you enjoyed watching this and listening to it. And feel free to support us on our mission to serve modern nurses, or even Rachelle's mission to serve the human collective, especially women that are in need of assistance during pregnancy. So, thank you again, and we'll see you all soon. Bye.